and today you were appointed here by your GP, right? Okay, so I read the report and it seems like you noticed some kind of pain in your ears. Is that correct? Alright, so could you just briefly answer some of my questions? Okay, that's perfect. I'll just take my notebook and I'll ask you some questions. So can we please start with, could you tell me your name? Yes, good. And the date of birth? Perfect. So, what kind of pain do you feel? Is it sharp? Is it dull? Maybe even pulsating? Okay. Dull and constant. Okay. On the scale from 1 to 10, with 1 being barely noticeable and 10 being super painful, can you tell me what pain do you feel? Okay. Around 2 to 3. Okay, that's not much. That's actually a good sign, really. Okay, could you tell me where do you feel the pain? Is it somewhere in the external part, or do you feel it like inside? You cannot really tell. That's alright, really. Okay, so did you notice any hearing troubles lately? Does it sometimes happen to you that when you are talking to a person, you actually cannot really understand what the people are saying sometimes? Maybe when you're in a loud environment or anything like that? Okay. Yes, that definitely happens sometimes. Do you listen to loud music? Okay, and does it often? Yeah, that's kind of a problem for everyone, I would say. We really have to be cautious about that, because then we can actually get some halos, conductive halos, and it's really not pleasant. So I definitely recommend to try to do it as not often as you can. Yeah, that's pretty not way good to say it, but okay. So another question is, do you work on a construction or in a loud environment? Perfect. Thank you. And another question would be, do you struggle with imbalance? Sometimes you just go and you trip over something and you lose your balance, but it's not like normal, it's just really, yeah. Glad to understand. No, you don't have such problems. That is perfect. Good. So, did you also have any head injuries lately, or maybe in the past? No. That's good. Okay. So another question would be, sometimes we feel pain in our ears, or maybe somewhere else, and it can still relate to the ear. Yeah, so do you feel any pain in the throat? No, that's the good sign. Perfect. And do you feel any pain in your teeth, like toothache. Perfect. And another question would be any groin or tummy pain, headache, anything like that? Not really. Perfect. So I'm briefly going to tell you what we are going to do. So what we are going to do right now is that I'm going to examine your ears. I'm going to take a close look at each and every one of them. First of all, can I please ask you to just put your hair a little bit to the side so I can actually see them at this moment. Perfect, thank you. You have lovely hair, by the way. Okay, so the ear seems to be pretty balanced, in the same height. No obvious redness, and no erythema. Okay, perfect. So I'm just going to briefly tell you what I'm going to do today. So I'm just going to look at your ears, each and every one of them. We are going to address where the problem is, whether it is in your inner ear, which looks like that, or external outer ear, which is this, or like in the ear canal, which is right there, and that is the inner ear. The inner ear actually parts into two segments, which is middle ear, which is the ear canal, and then there is really the inner ear, where it's actually kind of located behind the tympanic membrane, like your eardrum, yeah. And there's like cochlea and so on, and you stick into, yeah. I actually cannot really see there. I can see if the tympanic membrane is actually filled with blood, but that's pretty much everything. We will do some tests and we will see where the problem could actually be. So I'm going to first palpate the skin on your ears. Okay, and I will feel any tenderness. I will look for any lumps, bumps, erythema, or anything like that. Basically, tenderness is like one of the most important factors. So, yeah, that's it. I'm just going to get closer to you. I will take first my gloves. Okay. I'm just really going to get close to you and palpate your ear. Is that alright with you? Perfect. So I will start with this one, if you don't mind. Perfect. So let me look at it. So just now palpating your helix, which is the biggest and longest part of your ear. Do you feel any tenderness? Nope. Now your entire helix. Good. Now your lobule. How does it feel? Good. Perfect. Great. Now the tragus, and the mastoid. Okay. That's perfect. So there you feel no tenderness, right? I do not see any problems. It's a little bit rough, but that is pretty much normal. Actually, it should be, because we have like right above our ear, we have a huge artery, which really helps us to get like a rich blood supply. That's why ears are sometimes a bit more red. Yes, so now I'm going to do the same at the other side. Alright, great. Perfect. So just stay still. Okay, I'm just first going to tell you this is helix, this part. This is antihelix. Mastoid, right behind the ear. Lobule, tragus. Alright, so again, let me just palpate the helix. Any tenderness? Nope. No swelling, that's perfect. No redness. Perfect. Mastoid. Good. Perfect. That's just fine. Lobule and tragus. Okay. Okay. So I didn't notice anything really that we should be cautious about. Everything was pretty normal. Yeah, soon I will probably have to look into your ear. Yes, everything seems just fine. Okay. Good. Okay, so what we are going to do now, I'm going to do some hearing tests. Okay, so first off, I'm going to get closer to you and whisper in one of your ears while rubbing my fingers on the other side, and you will tell me if you could just hear me properly, and more like you will actually repeat the words I said. We will start with something simple and then we will proceed to something more difficult, okay? So I'm gonna start. A, D, X, Y, G, F. Okay, that was good. Now I'm going to tell you something a little bit more difficult, alright? 31, 64, 64, 25, 100, love, flirting. Okay, okay. So, did you have any problems hearing something? Okay. Did it seem imbalance? Imbalance? No. You think this A is a little bit harder to hear? Okay, that's good to know. Now I will ask you to. Okay, I'm gonna tell you first what I will do. I will be again rubbing my fingers. I will take a clap so that you can actually hear it better. I will take my hands and I will be widening them to side, and you will tell me when you stop actually hearing the sound. Okay, so what I'm gonna do is, or basically what you're gonna do is that you will close your eyes. You will close your eyes. Okay, just close them. close them. Close them. Perfect. And now I will just rub the fingers. Okay. Tell me when it stops. Good. Now I will just rub my fingers, okay? And you tell me on which side you hear it. Yes, that is correct. Okay, just really have your eyes closed, please. Because I know that you can see my hands, really just close it. That's good. You can open up your eyes now. Great. We will do this test of series even at the end. Now I will ask you to evaluate your hearing. If there was any kind of problem for you, you think, yes, the range in this ear again was a little bit limited. Yeah, so I will definitely look into this ear if there is any kind of blockage that has like developed. Okay. Yeah, it can be just that the fluid that your ear produces, has built up to use. Is there any chance you use Q-tips? Okay, and do you use it like only on the external part or even in the internal part? Okay, it actually can happen, that you kind of are pushing the wax like into the ear and it kind of makes the blockage, but it sometimes happens even without like you doing it. Yeah. Okay, so I'm just going to write down some notes. Isn't it a little bit hot in here? Good. That's perfect. So now that we did this, I will take my tuning fork. It actually has quite a high pitch, 136 hertz. I will make it vibrate and it will make a sound. I will put it to each and every one of your ears and you will tell me when you stop hearing it, okay? Perfect. Close your eyes. Tell me when you stop hearing it. That's great. That's great. So that will be it. You can also try a vapor test where I'm going to ring this tuning fork and I will put it at the top of your head and you will tell me if you feel the vibration and if you hear it and if the distribution is the same. Okay, so can you hear it now? Yes. So now tell me if you can hear it. Was it the same? Great. All right. I'm just now going to look into the internal part of your ear. Okay. I will take my otoscope, which is this beautiful tool. It actually has light in it. See, there is nothing really sharp in there. So what I'm going to do, I'm going to actually shine a light into your ears, okay? Like this basically. It's not hurtful. It can be a little bit unpleasant. Okay. It can be a little bit unpleasant, but it should not be hurtful. I'm just checking your cranial nerve responses. Because cranial nerves are actually connected even to the hearing, so let me just shine a light into your, okay. Good. So now I'm going to get to your ear. I'm just going to shine the light. Okay. And I will look into the ear. Please, I'm just going to touch your face with my hand so that I can actually feel your face when you're moving. I'm going in, and I'm looking for any redness, swelling, bumps and lumps that actually should not be there. That's good. Okay, I'm trying to see the tympanic membrane, but it's not visible due to a build up wax. Okay, so that means that we will actually have to clean the ear before I can see the tympanic membrane. It is not fully clogged, but it is from 85%, which means I can really see if there is an infection going on. Yeah, I will be really careful in case you actually have infection, so that I wouldn't hurt your ear, but that shouldn't really be the case. I actually think that the pain comes from just the blockage, so I'm just going to do the same with your other ear, okay? Perfect. So again, just hold still, and let me touch you with my hand, and let me examine the ear. So I can see the tympanic membrane right here. It is intact. That's good. That means that it actually touches. It means that it actually touches the walls. There is no rupture. Or hole in the tympanic membrane. I can see the light reflex, and that's it. Okay, there is no swelling, no redness. Good. No any weird humps and bumps. Again, there is a little bit excessive fluid build up, but it's about 40 to 50%. So it's actually not that much. so it's actually not that much. That means that we will have to actually clean both of them. We have their special mixture that I will spray into your ears, and the earwax will actually kind of absorb it, and it will make it easier to kind of scrub it off from the ear. Okay, yeah, perfect. So if we use just water, it wouldn't mix, because the earwax is actually not soluble, I think it is the word, soluble in the water. So let me just spray into your ear, okay? Okay. Okay, now the other one. Okay, the first one again. That's good. That's good. I'm just going to take a look inside. If it's already absorbing, great, it is. So I'm going to take my ear cleaning set, and you will use this beautiful tool. We'll use this beautiful tool so that we actually scrub the dirt out of your ear. So again, I'm going to take this otoscope, and I will look into the ear again, and I will clean it at the same time. It might be painful. If it is, just please tell me, okay? So let's do this. I'm just going to ask you to hold still. And there we go. There we go. Okay. So I managed to get the first kind of build-up. As you can see, it's kind of a lot. It's kind of a lot, right? Okay, I'm just going to put it in. Okay, now let's continue. Okay, it's going off quite easily because of the solution I used. That's good. You have nothing to worry about. Does it feel? Does it hurt? Okay. That's good. Okay. So I already got the earwax out of your ear. Do you want to see what it looks like? Yes, it's actually this much, but it's actually excessive a lot. It's not normal. very. That's probably why your hearing wasn't that good, especially in this ear. So I'm just going to look into the other one. Okay, so I'm just going to pass by a little bit, and let's do the same here. Okay. Okay. I'm trying to be really precise. That's good. That's good. Just hold still, and we're almost there. We are almost there. Perfect. You're doing an amazing job. You're doing an amazing job. I'm really proud of you. That's good. That's good. So, and we got it all out. And it looks like that. As you can see, it is much less than before. So, I'm just gonna put it away again. Perfect. And we are going to try the tests again. So just hold still. Do not worry, there is no wrong answer. I actually need to know if there is any improvement already. Yeah, good. Yeah, because if there isn't, it could actually be serious hearing loss. Okay, so let me just whisper. Okay. In your ears. Coincidence. Temperature. 999. One. Great job. Proud. Selfish. Okay. So, can you tell me if there was any difference? Okay. So you actually heard better this time. Alright, that's good to know. I'll look into the ear again, see if I can see the tympanic membrane and the light reflection now. Okay. Everything is there. No redness, no swelling, no lumps and bumps. Everything seems to be good. Okay. We'll try again to test with the finger flutters. With the finger flutters, the fingers rubbing, and you will tell me if you can hear it, at which side. You know the drill. Tell me when it stops. Tell me when it stops. Tell me when it stops. Good. Now, at which side do you hear it? You can open your eyes now. That's perfect. So, seems like everything is good, isn't it? Great. So, I think this is pretty much it for today. I'm glad you came by to visit us, to check your hearing, because many people actually do not come and they really have then the conductive hearing loss. And it's such a shame just because they are afraid. It wasn't hurtful at all, was it? Yeah, that's what I thought. So I'm really glad you came by, and hopefully we will not see one another again. I did not mean it in the wrong way, definitely. I just mean it that if you had any, we would have to see if you had any kind of problem again. So hopefully there will be none. But if you again show up, I will be most glad to be your doctor again. Okay. So, it was very nice to meet you. If you have any kind of problem, just call in. The receptionist will make an appointment. Great. So thank you very much, and bye. Have a wonderful, wonderful day. Yeah, the doors are right there. Yeah, the second left. Okay, Sarah, can you send the other patients in? Thank you.